Courtney McSweeney is a speech-language pathologist who helps people with neurologic disorders such as stroke and traumatic brain injury improve their speech, language, cognition, and swallowing abilities. She believes all people deserve the ability to communicate with one another. Today, Courtney is going to teach us about aphasia. Courtney, let's start with what aphasia actually is.
So, aphasia is a language disorder. It is acquired, meaning it always comes as a result of something. You cannot be born with it. Usually, aphasia is acquired from a brain injury or some sort of trauma or stroke. Stroke being the most common cause of aphasia. It's almost always an injury to the left hemisphere and can be as mild as simple word finding deficits or as devastating as almost completely impairing a person's ability to communicate. It affects both expression and comprehension, written expression, reading comprehension. It affects all the domains of language.
So, Courtney, you touched on a few of the causes, but what are some of the reasons that people can experience aphasia?
Stroke is the most common, but can also be a regular old brain injury, a traumatic brain injury, an aneurysm. It can be caused from brain tumors, brain surgery, brain infections like meningitis, or it can be a result of a progressive neurological condition like dementia. So, stroke is the most common cause, and according to the Aphasia Association, it can be seen in about 30 to 40% of adults who come to the hospital for a stroke will likely experience aphasia, whether it be acutely after the stroke or in the long term following.
Now, let's talk about the types of aphasia people can experience. The two most common are fluent and non fluent. What can you tell us about those?
Yeah, so we usually classify strokes as fluent or non-fluent, each with different subsets of more specific diagnoses. But for the most part, when we think non-fluent, we think of halted speech production, difficulty word finding. Speech is really effortful. Their content is really lacking. Sometimes they might get a few key words out, but they can't get their whole message out. Whereas in fluent aphasia, you sometimes might hear that as word salad. Patients can say a whole bunch of words, but they don't necessarily connect to anything or have any real meaning behind them. It can just be a bunch of words strung together without any real purpose.
Courtney, you mentioned stroke being a risk factor for aphasia. Let's talk a little bit more about that.
Yeah, so there are two main types of risk factors. Some are controllable, some are not controllable. And when we think controllable, we think about our medical conditions like high blood pressure, smoking, vaping, high cholesterol, if we're physically active, if we're overweight, any sort of cardiac conditions like a carotid or other coronary artery disease. Those are all things that are controllable based on how we take care of our bodies. Things that are uncontrollable are things like our age. As we're getting older, people at older age are at increased risk of stroke. Our gender is not controllable. Women are more at risk for stroke than men are. Women also are more often taking birth control pills, experiencing pregnancy. Those are things that place people at higher risk for stroke. Our hereditary background and our race is another uncontrollable risk factor. Black and Hispanic people are at greater risk for stroke than white and European people. And of course, people who've had strokes in the past are at greater risk of having a stroke again.
All right, let's talk about treatment for aphasia. When people ask about how is aphasia treated, what do you tell them?
So, aphasia can be treated one on one with a speech therapist or in group settings. Depending on the type of aphasia, the severity of aphasia, we might use different treatment approaches, whether they be restorative, where we're really aiming at restoring and regaining that language function and the impairment, or they might be compensatory, where we're working to help the person work around the deficits that might not be able to be fixed. So, often with compensatory treatment for aphasia, we might be using other means of communication. There's a lot of ways to seek out speech therapy, whether it be in the hospital, in a rehab hospital, at home, or in an outpatient setting. It can be one to one, it can be in small community support groups. There's a lot of different things that as speech therapists we are trained that know how to do for patients with aphasia.
Your work at the Abilities Research Center at Mount Sinai has put you in some interesting trials. One is called NeuroDevice. Let's talk about
Mhm.
that for a minute. What is it, and what types of people are you looking for to participate?
Yeah, so right now at the Abilities Research Center, we are actively recruiting for that clinical trial with NeuroDevice. The NeuroDevice trial is using non invasive brain stimulation for patients with chronic aphasia, and it's aimed at improving naming and word finding abilities while completing a language task and this non-invasive brain stimulation simultaneously. The treatment is for 2 weeks with speech therapy every day for those 2 weeks. We're looking for patients who've had a stroke in 6 months or longer ago with now chronic aphasia. You can be 18 to 80 years old, history of only one stroke with residual aphasia, so the stroke should be on the left hemisphere. Patients must be fluent in English and right-handed to participate.
Courtney McSweeney, speech language pathologist, with us here at Mount Sinai. Thanks for your time.
Thank you.